reply is important, but let's not forget that a budget reply merely gives a bit of an indication of the direction of an opposition. It's not an alternative budget in itself. The focus this week, quite rightly, should be on the Treasurer and his budget. And the budget is largely going to be underpinned going forward by this mining tax that we've been talking about. And Labor's approach is, if you see an industry that's prospering, if you see an industry that's going well, if you see an industry that's employing people, well, let's go and kick the heck out of it. It's a very funny approach, and we see speculation in the paper today that a feature of the budget is going to be a new focus on Australia as a financial centre, a new focus on Australia as a place to invest. Well, it's a pretty funny message to send out to the rest of the world that come and invest in Australia. Any day you could have tax arrangements change which fundamentally alter the economics of projects which have already been invested in, projects which are already underway. I think that's a very bad message to send.
There's a bit of other speculation as well, the suggestion that every GP will have a nurse in the GP clinic, $25,000 per doctor to ensure patients get appropriate follow-up care, prescriptions, essentially just helping with the treatment of patients. Is that true?
Well, I can't comment on budget speculation, but what I can say is that this will be a significant health budget, incorporating more than $5 billion of new investment in the health system to deliver shorter waiting times for elective surgery, shorter waiting times at emergency departments, more doctors, more aged care beds, better care for diabetes patients out in the community. Now, whether there will be more health announcements on top of that, I can't say, but look, Kieran, we've only got 36 hours to wait.
You're smiling.
We've only got 36 hours.
But do you think it's a good idea, this idea of having nurses at the GP level to provide that sort of that patient care that sometimes GPs probably don't have the time to ensure?
Look, I can't comment on the speculation in the Daily Telegraph, but what I can say is we have, since we've been in government, had a real focus on building up primary care so that people can be cared for in the community before they need to go to hospital. And one of the important elements of that from our point of view has been to use the skills of nurses in the community better. That is why we pushed through reforms over the course of the last several months.
But do we have enough nurses? Are there enough nurses I mean, if this is true, are there enough nurses out there?
Well, we've got a range of programs in place that we've announced recently to train more nurses, to bring more nurses back into the workforce who have qualifications that aren't currently nursing. So, yes, we need to build our health workforce. That was something that was grossly neglected, we think, over the last decade or more. But building up the skills and using the skills of nurses in the community is something we've been talking about for some time.
What do you think of that idea, if it is proven correct, that Telegraph story today about having nurses at the GP level?
Look, certainly there's the capacity to make better use of nurses in primary health care. They're highly skilled individuals. They can perform valuable triage functions, and in many contexts that already happens. So the concept isn't a bad one, but we'll have to wait and see the actual details in the budget itself. But even if this is a reality, what we see in the Telegraph today, we can't have any confidence in the government to implement it. We can't have any confidence in the government to honour a commitment. They abandoned the commitment in relation to not means testing the private health insurance rebate. The government said that they would fix public hospitals, and if they didn't, they'd take them over. They didn't fix them. They haven't taken them over. They've come up with this new concept of being the dominant funder. I don't recall Kevin Rudd going to the last election saying, we're going to fix public hospitals, and if we don't, we're going to become the dominant funder. That actually wasn't the commitment. So, sure, there might be a nice announcement in relation to nurses, but you can't have any confidence that the government will actually follow through.
Okay, let's look at a couple of other issues now. The sad news, apparently 5 suspected asylum seekers missing after they reportedly decided to swim for their troubled vessel using tubes and life jackets. It sounds like a terrible story. Mark, what do you know about it?
Well, I don't know any more than the reports that I've read as you have, Kieran. I mean, if those reports are true, it's a terrible tragedy, and it just reminds us how awful the practice of people smuggling is. Putting people who are desperate on these rickety boats to cross the seas is incredibly dangerous, and I think reinforces the commitment the government has to trying to stamp out people smuggling, along with the work that we're doing with Indonesia and others.
Mitch, what do you think? I mean, it just looks like one of those terrible tragedies that occurs, as Mark says, with this practice of people smuggling.
Yeah, look, it looks, unfortunately, as though it's going to be another shocking human tragedy. But sadly, these sorts of incidences are much more likely because of this government's border protection policies, because of the changes in August 2008. The change in rhetoric, much softer language by the government in relation to people smugglers, the abolition of temporary protection visas. As I've often said, this gave a good product to people smugglers to sell, and we're seeing that now with over 100 votes having come in.
Because that's what Julie Bishop said as well. We should get Labor's response.
Well, look, we've been through this a number of times with Mitch and Julie Bishop and others. You know, whenever there's an instance like this, they want to play politics with it. But look, we've got a very tough line on people smuggling. We've worked very hard with Indonesia in particular as the closest transit country to Australia to work on ways in Indonesia and here in being very clear about the offences that will be in place against people smuggling, and we think we've got the balance right. Does that mean that you won't get the odd tragedy that appears to have occurred out in the ocean again today? Well, it probably doesn't, but we are, and it happened under the previous government as well, but we are doing everything that we can to stamp out people smuggling, both in our own jurisdiction and in terms of our work with Indonesia.
Okay. Mitch, you wanted to say something?
The government might be doing everything they can, but clearly it's not working because the boats are still coming, the people smugglers are still plying their trade, people are still finding themselves at great risk, and if we're to believe the speculation in the papers today that the government is going to be throwing money at the Department of Immigration in relation to border protection issues, that is a further admission by the government that they're failing dismally. Now, the answer isn't to throw more money at the Department of Immigration. The answer is to change the policy.
Okay, one very different story to finish on, a very different tone. The Liberal Party ad campaign. It looks like you're going to sign up John Singleton, singer. Is that he masterminded Bob Hawke's election?
Yeah, well, who knows? He's got a colourful history. He worked for Hawke. I think Sengo founded the Australian Workers' Party, a bit of a libertarian outfit many decades ago. He's an interesting guy with a lot of talent, but those decisions are ultimately matters for our federal director. But what's ultimately going to matter at this election isn't which particular ad man or woman that each party has. It's going to be whether you can gain the trust of the Australian people. And Kevin Rudd, I think, has lost the trust of the Australian people. That fundamental compact of trust between the voters and a Prime Minister, he has broken by showing he can't govern and by breaking his word time and again.
Mark Butler, the Liberals started with an advertising campaign last night. They're not waiting for the election campaign. It looks like they're fairly well organised early this year, unlike the last campaign where it has to be said it was a bit of a schmozzle for the Liberals. This time they look like they've got their act together.
There's a fair bit of spin going on. We've read reports of Tony doing acting classes apparently as well. I mean, between his acting classes and his sporty spice routine in the ocean and on the bike, I'm not sure whether he finds time to craft a budget speech and come up with an economic policy, and that's really what people are looking for, I think, more than ads and spin and acting classes.
Sporty spice. I've heard it all now. Well, that's great, Mark Butler and Mitch Fifield. Appreciate your time. Thanks.
Thanks, Kieran.
Stay with us after the break on AIM Agenda. We're going to take a look at the day ahead in business. Stay with us.